Welcome back, everybody. Ready for another deep dive?
Absolutely. I'm always ready to dive in.
All right, well, today we are looking at something pretty incredible in the world of medical imaging. Specifically, a new technique for CT scans, creating these super high-resolution images.
Yeah, the level of detail they are achieving now is really remarkable.
Yeah, and we've got a fantastic scientific paper to unpack today all about this.
Sounds good.
But there's a twist, right?
Yeah, there are always some things to consider with any new technology.
Exactly, and this research also kind of hints at some potential downsides, even ethical considerations, with using patient data for this kind of technology.
Yeah, I think that's a really important conversation to have.
So let's start with the why. Why are high-resolution CT scans so crucial in the first place?
Well, imagine trying to diagnose a condition from a blurry photograph.
Yeah.
You'd be missing so many vital details.
Absolutely. Crucial details.
Right. High-resolution CT scans are all about providing doctors with that clear and detailed view they need to make accurate diagnoses.
Yeah, the paper actually compares it to trying to find a tiny crack in a bridge, but like from miles away.
Oh, wow.
You really need that close-up view, that high-resolution view to even see the problem.
That's a great analogy.
So how does this new technique actually work? I mean, is it like those older methods where you just kind of stretch and enlarge the image?
No, not at all. This is where AI comes in, and that's where it gets really exciting, I think.
Okay.
This technique uses AI to predict the missing details in a low-resolution image. It's kind of like having an AI detective, right?
Oh, I like that.
That can analyze the clues and then piece together this much more complete picture.
So it's not just filling in the blanks, it's using the existing information to create a sharper, more detailed version.
Yeah, exactly.
Okay, so AI, it's powerful, but is it always reliable?
Yeah.
What if it gets something wrong?
That's a great question. And that's one of the key challenges the researchers are trying to address. AI, it's powerful, but it's not perfect.
Yeah.
And this paper points out a potential problem, distortion in the enhanced images, especially when it comes to really crucial structures, like blood vessels.
So you're saying the AI could make a blood vessel look bigger or smaller than it actually is.
Exactly.
And that could lead to a misdiagnosis.
Yeah, it's a big deal.
Wow.
The paper actually includes a visual, an example of a blood vessel that's been distorted by the super-resolution process. It's a good reminder that we can't just blindly trust the output of these algorithms.
Absolutely. So what are the researchers doing to tackle this distortion problem? They're not just giving up, are they?
Oh, no, they're not giving up. The paper actually proposes a new method.
Okay.
It uses something called a dual-stream diffusion model. Now, that might sound complicated.
Yeah, a little bit.
But the basic idea is that it uses two separate AI networks working together.
Okay, so like two sets of eyes on the problem.
Yeah, exactly.
But how does that help with the distortion issue?
Well, one network focuses on enhancing the overall image quality.
Okay.
It's like an artist, adding details, smoothing out the rough edges.
Okay.
But the other network, it acts more like an anatomist, making sure those enhanced details are accurate and true to the underlying anatomy.
So one is about making it look good. The other is about making sure it's right.
Yeah, a good way to put it.
Clever.
Yeah.
But did they actually test this new method to see if it actually works?
Absolutely. Yeah, they did. They applied it to two specific medical tasks.
Okay.
Detecting lung nodules and segmenting airways and blood vessels. Basically, they wanted to see if the AI could accurately identify these structures in the super-resolution images. The results were impressive. Sometimes the super-resolution images created with this dual-stream method, they were even better than the original high-res images.
Wait, hold on. So you're saying this AI can sometimes spot things that even trained doctors on a regular scan might miss?
Yeah, it really highlights the potential of this technology.
That's incredible. It really is.
Yeah.
But before we get too carried away, we mentioned earlier, there are some ethical considerations, especially when it comes to using patient data to train these AI algorithms.
Right, that's a crucial point. The paper mentions that they did receive ethical approval to use patient data.
Okay.
But it does make you think about the specifics of patient consent and data privacy.
Absolutely. Did the patients whose scans were used even know how their data was being used?
Yeah, it's a good question.
Were they given a choice?
These are really important questions to consider as this technology continues to develop.
Absolutely. Yeah, it really emphasizes the need for transparency in this field. If our medical data is being used to train these AI systems, shouldn't we at least know how it's being used?
Oh, absolutely. And what safeguards are in place? It's a conversation that needs to involve everyone.
Yeah, doctors, patients, and the researchers. Everyone on the same page about the ethical implications.
Exactly.
Okay, so we've talked about the benefits, that distortion issue, the ethical stuff. But can we zoom out for a minute and talk about the big picture?
Sure.
What does this technology mean for the future of medical imaging?
I mean, think about a world where these high-quality CT scans, they're more affordable, accessible to everyone.
Yeah, especially for people in rural areas or developing countries, those who might not have access to the latest technology.
Yeah,
That would be incredible.
it would. And it's not just about CT scans, this super resolution approach. It could be applied to other medical imaging techniques, too.
Like ultrasound, MRI.
Exactly.
So we could be seeing a ripple effect across the entire field of medical imaging.
Yeah, it's pretty exciting.
It really is. But let's not forget about the risks, right? We talked about the distortion issue. What else should we be thinking about?
Well, one thing that comes to mind is the potential for over-reliance on these AI-enhanced images. It's a tool. It's not a replacement for human expertise.
Yet doctors still need to interpret these images critically, not just blindly accepting everything the AI produces.
Absolutely. It's about finding that balance, human expertise, and AI assistance.
It's partnership, not a replacement.
Exactly.
You know, one thing I thought was really interesting is the researchers actually made their source code publicly available.
Yeah, I saw that. It's fantastic.
It's great for transparency in research,
Yeah,
and it allows others to build upon their work,
right.
potentially accelerate the development of even better techniques.
Right, open science at its best.
And for those who are more technically inclined,
Yeah.
it's fascinating to see how this technology works under the hood.
Oh, absolutely.
Okay, but let's get practical for a second. If you were a doctor, would you trust a diagnosis based on a super resolution image?
That's a tough question. I think it would depend.
On what?
The specific condition, the quality of the AI system, even my own confidence in interpreting the images, there's no easy answer.
It's a decision that's going to become more and more common, right, as this technology advances.
It is, and it's not just up to doctors to figure this out.
Right.
Patients need to be educated about AI's role in healthcare.
Absolutely. It's a societal challenge as much as a technological one, isn't it?
It really is.
We need to have open and honest conversations about the implications of AI in healthcare. Make sure everyone's comfortable with how it's being used.
I agree.
You know, this paper we've been discussing, it's a great starting point for those conversations.
It is. It highlights the amazing potential of AI.
Yeah.
But it also reminds us that we need to think carefully about the ethical side of things.
It's a reminder that we're at a turning point in healthcare.
A turning point.
And we all have a role to play in making sure AI is used for good.
I couldn't agree more.
And who knows what other discoveries are waiting to be made in medical imaging.
I can't wait to see what the future holds.
Me neither. But there's still a lot to uncover from this paper.
Yeah.
Especially how they actually put this dual-stream model to the test. They didn't just stop at making the images prettier.
Right.
They actually wanted to see how they worked in real-world medical scenarios.
Yeah, that's the heart of good science. It's not enough to just come up with a new technology.
Right.
You have to test it. You have to prove that it has practical value.
Yeah, and in this case, they focused on two main things: detecting lung nodules and then segmenting airways and blood vessels. Can you break down those tasks a bit more?
Sure. So detecting lung nodules, that's pretty straightforward. You're looking for small abnormal growths in the lungs.
Which could be a sign of cancer.
Exactly. And the earlier you can detect them, the better the chances of successful treatment.
Okay, makes sense. But what about segmentation? That sounds a bit more technical.
It is a little bit, but think of it like this. You have a map of a city.
Okay.
You see streets, buildings, everything. But it's all kind of mixed together.
I'm picturing it.
Now imagine if you could highlight certain features, just the highways or just the parks.
Okay, I do.
That's basically what segmentation does. It lets you isolate specific structures in an image, analyze them in more detail.
So in medical imaging, you could highlight just the airways in a lung scan or the blood vessels in a heart scan.
Exactly. It allows doctors to see those structures more clearly, see their size, their shape, their overall health.
So the researchers used this dual-stream model to create the super-resolution images, and then they tested how well they performed in these tasks, detecting the lung nodules, segmenting the airways and blood vessels. What were the results like?
Well, in many cases, the super-resolution images, they actually did better than the original high-resolution images in those tasks.
Hold on. So the AI-enhanced images They were sometimes better than the images that were already at a higher resolution.
Yeah.
That's amazing.
It is. It really shows that AI can enhance images visually,
Yeah.
but also improve their diagnostic value at the same time.
It's not just about making things look pretty. It's about making them useful for doctors.
Precisely. And that's what makes this research so exciting.
It's not just a technological advancement. It's a potential game changer for diagnosis.
It is.
But as we said before, with any new technology, especially one as powerful as AI, we have to consider the ethical implications.
Absolutely. This specific research might not dive deep into the ethics, but we can't forget about them.
We need to make sure these tools are used responsibly, ethically, in a way that benefits everyone.
I agree. It requires a conversation between researchers, clinicians, policymakers, and the public.
So it's not just about scientific progress. It's about being responsible.
It is.
It feels like we're on the verge of something huge in healthcare. Like AI is not just a tool anymore. It's actually a partner.
It is, and this paper, the one we've been talking about with the super-resolution imaging, it's just the tip of the iceberg.
So where do we go from here? What's next for research in this field?
Well, one really exciting area is developing AI systems that can do more than just enhance images. Imagine AI that could actually provide diagnostic insights.
Like it analyzes a CT scan and then flags potential problems for the doctor?
Exactly, like a second set of expert eyes, especially in busy hospitals where doctors are under so much pressure.
Yeah, that would be invaluable.
And these AI systems, they could be trained to spot really subtle patterns in images, things that are hard for us to see.
So we could potentially be diagnosing diseases earlier when treatment is more effective.
That's the goal. Early detection is key.
That's incredible. It really is. It sounds like AI could completely revolutionize how we see the human body, but also how we understand and treat disease.
And it goes beyond just diagnosis. Imagine AI helping surgeons plan complex surgeries based on a patient's unique anatomy.
Wow.
Shorter recovery times, fewer complications.
That would be a game changer.
It would.
The possibilities seem endless. But we have to be aware of the challenges from.
Of course. Reliability is a big one. We need to make sure these AI systems are accurate, that they're not introducing biases or errors into diagnoses.
So rigorous testing is key.
Absolutely. And we need to make sure these systems are accessible to everyone, not just wealthy countries or elite hospitals.
It has to be equitable.
It does. Everyone should benefit from these advancements.
This has been an incredible deep dive into the world of super-resolution imaging and AI in healthcare. It seems like we're on the cusp of a major shift in how we diagnose and treat diseases.
It is an exciting time.
It's exciting, but it's also a little daunting, to be honest.
It is. There's a lot to consider.
Well, that brings us to the end of our deep dive for today. We hope you found it as fascinating as we did.
If you'd like to learn more, be sure to check out the links in the show notes. We've got the research paper and other resources there.
And remember, the future of healthcare is something we're all building together. So stay informed, stay curious, and keep asking those questions.
We'll be back next time with another deep dive into the world of science and technology. Until then, take care.